Hello everyone, now let us discuss about 2023 CPT coding guidelines for surgery, eye and ocular adnexa part 2b. In the current session, we will be discussing the CPTs in the range 661302 to 66999. In the current session, we will be discussing about the following segments. The first one is anterior sclera, next is iris or ciliary body, lens, intraocular lens procedures, and finally other procedures. The CPT range for anterior sclera is 661302 to 66250, and for iris and ciliary body it is 66500 to 66770, and for lens the CPT range is 66820 to 66940, and for intraocular lens procedures the CPT range is 66982 to 66986, and finally other procedures they come under the range 66990 to 66999. First of all, coming to anterior sclera. Anterior sclera is again divided into excision, aqueous shunt, repair or revision. And the CPT range for excision is 66130 to 66175. And for aqueous shunt, it is 66179 to 66185. And for repair or revision, the CPT range is 66225 to 66250. Now, first of all, coming to excision. For removal of intraocular foreign body, you need to refer 65235. And for operations on posterior sclera, you need to use 67250 to 67255. Here, coming to the first CPT in excision, that is 66130. Excision of lesion sclera. The next is 66150. Fistulization of sclera for glaucoma, trephination with iridectomy. The next is 66155. Fistulization of sclera with thermoquarterization with iridectomy. The next is 66160. Fistulization of sclera for glaucoma. Here, sclerectomy with punch or scissors with iridectomy. Coming to next CPT, that is 66170. It deals with trabeculectomy AB externo in absence of previous surgery. And for trabeculotomy AB external, you need to use 65850. And for repair of operative wound, you need to use 66250. The next CPT is 66172. It deals with trabeculotomy AB external with scarring from previous ocular surgery or trauma, including injection of anti-fibrotic agents. The next is 66174. It deals with transluminal dilation of aqueous outflow canal. For example, cannuloplasty without retention of device or stent. And do not report 66174 in conjunction with 65820. The next is 66175. It deals with transluminal dilation of aqueous outflow canal with the retention. Previously it is without retention. Now it is with retention of device or stent. Now coming to aqueous shunt. The first CPT is 66179. Aqueous shunt to extraocular equatorial plate reservoir external approach without graft. And if the procedure is performed with the graft, the CPT is 66180. And do not report 66180 in conjunction with 67255. The next CPT is 66183. Insertion of anterior segment aqueous drainage device without extraocular reservoir external approach. The next is 66184. Revision of aqueous shunt to extraocular equatorial plate reservoir without graft. Next is 66185. If it is performed with the graft, the CPT is 66185. And do not report 66185 in conjunction with 67255. And for the removal, it is revision. For the removal of implanted shunt, you need to use 67120. Now coming to CPTs for repair or revision. For scleral procedures in retinal surgery, you need to refer 67101 series. The first CPT here is 66255. Repair of scleral staphyloма with graft. And for scleral reinforcement, you need to see 671 250 and 67255. The next is 66250. Revision or repair of operative wound of anterior segment, any type, early or late, major or minor procedure. Now coming to the next segment, that is iris and ciliary body. Iris and ciliary body are again divided into incision, excision, repair and destruction. The CPT range for incision is 66500 to 66505, and for excision it is 66600 to 66635, and for repair the CPT range is 66680 to 66682, and for destruction the CPT range is 66700 to 66770. Now first of all, coming to incision CPTs, the first one is 66500. Iridotomy by swap incision except transfixion. Iridotomy by swap incision. The next is 66505. Iridotomy by swap incision with transfixion as for iris bomb. And for iridotomy by photocoagulation, you need to refer 66761. Coming to the next CPT, that is 66622. Iridectomy with corneoscleral or corneal section for removal of lesion. The next is 66605. Iridectomy with cyclectomy. The next is 66625. Iridectomy peripheral for glaucoma. The next is 66630. Iridectomy sector for glaucoma. The next is 66635. Iridectomy optical. And for chorioplasty by photocoagulation, you need to refer 66762. The next CPT is 66680. Repair of iris, ciliary body as for iridodialysis, and for reposition or resection of uveal tissue with perforating wound of cornea or sclera, you need to use 65285. The next is 66682. Suture of iris, ciliary body. It is repair of iris ciliary body. The next is suture of iris ciliary body with retrieval of suture through small incision. For example, McCannal suture. The type of suture is McCannal suture. Coming to destruction CPTs, the first one is 66700. Ciliary body destruction, dithermy. The next is 66710. Ciliary body destruction by cyclophotocoagulation transcleral. The next is 66611. Ciliary body destruction by cyclophotocoagulation endoscopic without concomitant removal of crystalline lens. And for endoscopic cyclophotocoagulation performed at same encounter as extracapsular cataract removal with intraocular lens insertion, you need to refer 66987 and 66988. And do not report 66711 in conjugation with 66990. Because here endoscopy is already included in the procedure. The next CPT is 66720. Ciliary body destruction by cryotherapy. And next is 66740. Ciliary body destruction by cyclodialysis. Next CPT is 66761. Iridotomy or iridectomy by laser surgery. Example for glaucoma per session. The next is 66762. Iridoplasty by photocoagulation, one or more sessions. Example for improvement of vision, for widening of anterior chamber angle. Next is 66770. Destruction of cyst or lesion, iris or ciliary body, non-excisional procedure. And for excisional lesion, iris ciliary body, C 66600 605. For removal of epithelial downgrowth, use 65900. And for unlisted procedures, you need to refer 66999. Now let us see an example. A 65-year-old with a history of chronic glaucoma has progressive optic nerve damage and elevated intraocular pressure. a clear corneal incision is made and viscoelastic material is injected into the anterior chamber over the lens to increase and maintain the anterior chamber depth. The endoscope is inserted through the temporal incision to view the nasal ciliary processes, which is coagulated with the end point of shrinkage and whitening. Endoscope is moved in an arc, allowing the treatment of the process over an arc. Ciliary processes are destroyed. So here the destruction of ciliary body is done by photocoagulation. Here the surgeon completed the coagulation procedure. And endoscope is also used. If you see here, the endoscope is inserted. So the appropriate CPT is 66711. Ciliary body destruction, cyclophotocoagulation, endoscopic without concomitant removal of crystalline lens. Let us see one more example. The physician performs a iridotomy using laser on both eyes for chronic angle closure glaucoma, that is moderate. Procedure includes local anesthesia. Here the CPT is 66761 along with 50 modifier to include the bilateral procedure, to indicate the bilateral procedure, because the procedure is performed on both eyes. 66761 along with 50 modifier. Iridotomy or iridectomy. Here iridotomy is performed by laser surgery for glaucoma per session. Now coming to the next topic, that is lens. Lens is again divided into incision and removal. The CPT range for incision is 66820 to 66825. And for removal, the CPT range is 66830 to 66940. First of all, coming to incision. The first CPT is 66820. Dissection of secondary membranous cataract, opacified posterior lens capsule and or anterior hyaloid. Stab incision technique. For example, Zeeler or Wheeler knife. The next is 66821. Decision of secondary membranous cataract by laser surgery. For example, YAG laser. One or more stages. The next CPT is 66825. Repositioning of intraocular lens processes requiring an incision. Now, let us see an example here. The physician creates an opening in the opaque posterior lens capsule of the patient's right eye by cutting an inverted U shape of the tissue. The cut is made using a YAG laser. Here, YAG laser is used. And incision is done, which is nothing but decision. The tissue within the inverted U falls down and out of the patient's field of vision. The procedure is done to improve the vision of the patient with a secondary cataract. So here the CPT is 66821 along with RT modifier to indicate the right eye, right side. Decision of secondary membranous cataract by laser surgery, for example, YAG laser. Now coming to a note. First of all, coming to removal CPTs, below that you can find a note. Lateral canthotomy, iridectomy, iridotomy, anterior capsulotomy, posterior capsulotomy, the use of viscoelastic agents, enzymatic zonolysis and use of other pharmacologic agents, and subconjunctival or subtendon injections are included as a part of the code for extraction of the lens. So coming to the first CPT, that is 66830. Removal of secondary membranous cataract, opacified posterior lens capsule and or anterior hyaloid with corneoscleral section, with or without iridectomy, iridocapsulotomy and iridocapsulectomy. The next is 66840. Removal of lens material, aspiration technique, one or more stages. The next is 66850. Removal of lens material Phaco-fragmentation technique, mechanical or ultrasonic. For example, phaco-emulsification with aspiration. The next exhibit is 66852. Removal of lens material, pars plana approach, with or without virectomy. The next exhibit is 66920. It deals with removal of lens material intracapsular. The next is 66930. It deals with removal of lens material intracapsular for dislocated lens. And next is 66940. It deals with removal of lens material extracapsular, other than 66840, 850 and 852. And for removal of intra-lenticular foreign body without lens extraction, you need to use 65235. And for repair of operative wound, you need to use 66250. Now coming to next session, that is intraocular lens procedures, which come under the range 66982 to 66986. First coming to first CPT 66982, extracapsular cataract removal with insertion of intraocular lens prosthesis. One stage procedure, manual or mechanical techniques. For example, irrigation and aspiration or phacoemulsification, complex, requiring devices or techniques not generally used in the routine cataract surgery. For example, iris expansion device, suture support for intraocular lens, or primary posterior capsulorhexis excision are performed on patients in the amblyogenic developmental stage without endoscopic cyclophotocoagulation. For that, the CPT is 66982. In simple terms, extracapsular catheter removal with insertion of intraocular lens prosthesis. Complex. Then you can quote 66982. And for complex without endoscopic cyclophotocoagulation. And for complex extracapsular cataract removal with concomitant endoscopic cyclophotocoagulation, you need to use 66987. And for complex extracapsular cataract removal with intraocular lens implant and concomitant intraocular aqueous drainage device by internal approach, you need to use 66989. And for insertion of ocular telescope prosthesis, including removal of crystalline lens, use 03083 8T 03080. The next exhibit is 66989. This is extracapsular removal with insertion of intraocular lens prosthesis with intraocular anterior segment aqueous drainage device without extraocular reservoir, internal approach, one or more. And for complex extracapsular cataract removal with intraocular lens implant without concomitant aqueous drainage device. This is with the aqueous drainage device. Here, without aqueous drainage device, the CPT is 66982. And for insertion of intraocular anterior segment drainage device into the trabecular meshwork without concomitant cataract removal with intraocular lens implant, you need to use 0671T. The next CPT is 66987. It deals with extracapsular cataract removal with insertion of intraocular lens prosthesis with endoscopic cyclophotocoagulation. And for complex extracapsular cataract removal with intraocular lens implant without concomitant aqueous drainage device, you need to use 66982. And for insertion of ocular telescope prosthesis including removal of crystalline lens, you need to use 03080. The next CPT is 66983. intracapsular cataract extraction with insertion of intraocular. Previously it is extracapsular, now it is intracapsular cataract extraction with insertion of intraocular lens prosthesis. The next CPT is 66984, extracapsular cataract removal with insertion of intraocular lens, manual or mechanical technique, for example irrigation and aspiration or phacoemulsification without endoscopic cyclophotocoagulation. If it is complex, the CPT is 66982. This is simple. That is, it is not complex. Then it is 66984. And for extracapsular cataract removal with concomitant endoscopic cyclophotocoagulation, the CPT is 66988. And for extracapsular cataract removal with concomitant intraocular aqueous drainage device by internal approach, the CPT is 66991. And for insertion of ocular telescope prosthesis, including removal of crystalline lens, you need to use 03080. And next is for insertion of intraocular anterior segment drainage device into the trabecular meshwork without concomitant cataract removal with intraocular lens implant, you need to use 0671T. The next CPT is 66991. It deals with extracapsular cataract removal with insertion of intraocular lens. With the insertion of intraocular anterior segment aqueous drainage device without extraocular reservoir, internal approach one or more. And for extracapsular catheter removal with intraocular lens implant without concomitant aqueous drainage device, you need to use 66984. And for insertion of intraocular anterior segment drainage device into the trabecular meshwork without concomitant cataract removal with intraocular lens implant, you need to use 0671T. Next CPT is 66988. It deals with extracapsular cataract removal with insertion of intraocular lens prosthesis with endoscopic cyclophotocoagulation. These are all simple. They are associated with, if the procedure of extracapsular cataract removal with insertion of intraocular lens is simple, then these are the associated things. And if it is complex, the respective CPTs are 66989 and 87. If it is simple, it is 66991 and 66988. The next CPT is 66985. Insertion of intraocular lens prosthesis. Secondary implant not associated with concurrent cataract removal. Previously, they are all associated with concurrent cataract removal. Simply insertion of intraocular lens prosthesis not associated with concurrent cataract removal. The CPT is 66985. And to code implant at the time of concurrent cataract surgery, you need to refer 66982, 83 and 84. And to report supply of intraocular lens prosthesis, you need to use 99070. And for ultrasonic determination of intraocular lens power, the CPT is 76519. And for removal of implanted material from anterior segment, you need to use 65920. And for secondary fixation, you need to use 66682. And for use of ophthalmic endoscope with 66985, use 66990. The next CPT is 66986. It deals with exchange of intraocular lens. And finally, coming to other procedures, the first CPT is add-on CPT, that is 66900. Use of ophthalmic endoscope. As it is an add-on code, it must be listed separately in addition to the code for primary procedure. And 66990 may be used only with the codes 65820 875 65920 66985 66986 67036 67039 67040 67041 67042 67043 and 67113. Finally, 66999 deals with unlisted procedure anterior segment of eye. Now let us see an example. The surgeon performs an insertion of intraocular lens prosthesis. Here, insertion of intraocular lens prosthesis is performed in the current session. Treatment plan was established and discussed with the patient 6 weeks earlier when the cataract was removed. Here, cataract and insertion are not done in the same session. In the previous session, which is 6 weeks earlier, cataract was removed. And now, the same surgeon is performing an insertion of intraocular lens prosthesis. So, here the appropriate CPT is 66985 along with 58 modifier. 58 modifier indicates staged or related procedure or service by same physician during the post-operative period. If a planned or related procedure is performed during the post-operative period by the same physician or other qualified healthcare professional, you need to use 58 modifier. Here it is a planned procedure within the post-op period because 6 weeks earlier cataract was removed and now the same surgeon is inserting the intraocular lens prosthesis. So the CPT is 66985 along with 58 modifier. And the description for 985 is insertion of intraocular lens prosthesis, that is secondary implant not associated with concurrent cataract removal. Now let us see one more example. A patient is diagnosed with nuclear sclerotic cataract, right eye. She is taken to the operating room and a phacoemulsification with intraocular lens right eye is performed. So here cataract removal with intraocular lens is performed, but this is not a complex procedure. So the appropriate CPT is 66984 along with RT modifier to indicate the right side. 66984 deals with extracapsular cataract removal with insertion of intraocular lens. One stage procedure, manual or mechanical technique, for example, irrigation, aspiration or phacoemulsification. In the current example, phacoemulsification is performed without endoscopic cyclophotocoagulation. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.